Hello dear students, welcome once again to our Homeo classes. In last lecture we have discussed about the antepartum hemorrhage, its definition, its causes. We have discussed the causes in detail. The cause placental bleeding, okay, and the subtypes of the placental bleeding, that placenta previa and the abruptio placentae. In that we have started with the placenta previa. We have discussed about its definition, then theories related with its causes. In today's lecture, we are going to discuss about the types of the placenta previa. These types, they are also called as degrees of the placenta previa. These degrees are according to the extension of the placenta into the lower uterine segment. So, let us start with the first type. The first type is called as low-lying type. Okay, in this diagram, you can see the placenta. Okay, this is the internal os, this is the placenta. So in the first type, the major part of the placenta, it lies or it is attached in the upper segment, and only the low margin of the placenta, it reaches near the inner os. Okay, it does not cover it. Then next type is called as the marginal type. In this type, the margin of the placenta, it reaches nearby the internal os, but it doesn't cover it completely. The third type is called as partial or the incomplete type. In this type, you can see in this diagram that the placenta, it covers the internal os, but it doesn't cover it completely. So the name partial or the incomplete placenta previa. Fourth type is called as the complete or the central placenta previa. In this diagram, you can see the placenta, it covers completely the internal os. So this is called as complete or the central placenta previa. Okay, you have to remember all these types, and you can draw these diagrams and explain each and every type in the examination. So it will be a nice presentation and you will get the nice marks. Okay. Here we have completed the types. If you want to take the screenshot of this diagram, you can take it. Now we'll discuss about the clinical features of the placenta previa. So the first symptom is the vaginal bleeding. It is of sudden onset. Okay, remember the onset is always sudden. The character of the blood is bright red. Okay, the bleeding, vaginal bleeding is always of bright red color. Then it is a painless bleeding. So without any pain, that bleeding is continuous and the recurrent bleeding. Then unrelated with the activity. Okay, so usually this placenta previa bleeding will be in a sleeping position also. So it is not always related with the activity. Then lastly, it is a recurrent type of bleeding. Okay, so these are the symptoms: vaginal bleeding, sudden onset, bright red in color, painless bleeding, unrelated to activity, and recurrent in nature. Then what are the signs? So the general condition of the patient is always related with the severity of the bleeding. If the bleeding is heavy or severe in nature, then the condition, general condition of the patient will get deteriorated and the patient will land into the anemic condition. Okay. Then if you do the per abdominal examination, okay, what you will observe. So if you do the palpation, the size of the uterus will be always related with the period of amenorrhea. Secondly, if you feel the uterus, the feel of the uterus will be soft, elastic, and there will be no localized area of tenderness. Then there will be the persistence of the malpresentation. There will be no change in the presentation. Then head is always floating. And lastly, the fetal heart sounds. If you try to auscultate the fetal heart sounds, they will usually present. Okay. So these are the per abdominal examination signs, and you can observe and you can feel the uterus and auscultate the fetal heart sounds. Okay. Now about the confirmation of the diagnosis. How you will confirm that it is a placenta previa bleeding? So according to these clinical features or the symptoms, the vaginal bleeding is always painless, recurrent vaginal bleeding will be there. So this is the confirmation. By these symptoms you can confirm that this is a placenta previa bleeding. Okay. Also with the help of ultrasonography, color Doppler and MRI, you can confirm the diagnosis. Okay. Now we'll discuss about the differential diagnosis. First is the abruptio placentae that we'll discuss in our next lecture. Then early rupture of membrane. Third one is the postpartum hemorrhage. Second, cord prolapse and retained placenta. Okay, so these are the differential diagnosis. First is the abruptio placentae, early rupture of membrane, PPH, cord prolapse and the retained placenta. Now what are the complications of this condition? The complications are as follows. First, there are the chances of shock, malpresentation, sepsis can occur, subinvolution of the uterus and other pelvic organs can occur, embolism and the transverse line. Okay, so these are the complications of this placenta previa. Then what are the fetal complications? Fetal complications are asphyxia, birth injuries, congenital malformations can occur, low birth weight baby, fetal growth restriction. Okay, so these are the differential diagnosis and the complications related with mother and the fetus. Here we have completed the placenta previa. In next lecture we will discuss about its homeopathic management. Okay, if you want to take the screenshot of this differential diagnosis and complications, you can take it. If you have any queries related with this particular topic, you can comment me in comment box. And if you have any suggestions of new topics, that also you can suggest me. Okay. If you like the video, please hit the like button, share among your friends and subscribe.